We all want to eat food that is good for us, right? But new studies and recommendations are making it more confusing. And with all the concerns about mercury and contamination, what is safe to eat? Well, Chief Medical Correspondent Dr. Michael Roizen is with us. He's with the Dr. Oz Show and many other facilities. He's going to help us out. Good morning, doctor. Apparently, the FDA has made all kinds of changes. Can you tell us what they are?
Well, good morning, Angela. This actually relates to the fact that we were following one of the FDA prior recommendations to avoid shark and swordfish, mackerel, tilefish, and blue tuna during pregnancy too well. That is, those we do want to avoid, but we don't want to avoid fish because the DHA, that fish oil with the 3 letters, DHA, is important for early childhood brain development and visual development, eyesight development. So the FDA said it wants you, if you're pregnant or breastfeeding, to get 2 to 3 servings of healthy fish, salmon, anchovies, sardines, white tuna, and that the benefit vastly outweighs the risk of the mercury in them because it is so important. The DHA is so important for brain and eyesight development. And if you don't like fish, I know you're a pescatarian, which is almost ideal for pregnant ladies, but if you don't like fish, then you can get fortified food, such as the tomato sauce has DHA, and this Jif peanut butter that's fortified with omega-3s has DHA. Read the label, get 200 milligrams of DHA a day. Worst, you can get supplements that have DHA, 3 letters. If you're vegetarian, there are the DHA actually comes from the algae. The fish don't make it themselves. They have the DHA. So get 200 milligrams of DHA. That's the FDA draft recommendations for pregnant and breastfeeding women.
Ah, that's good stuff. All right, so even if you don't like fish, there's something for you to help you. Okay, what if you do like fish? Like you said, I'm a pescatarian. But how do you know which ones are the good ones? How do you figure that out?
So the only fish that we know that you have to avoid are those that have a lot of mercury. There are only 5 that really have it. Tilefish, that's banned in the United States, but some still sneaks in. Swordfish, shark, mackerel, and blue tuna. So those 5 you want to avoid. Every other fish is fine, and mix it up. But in fact, the salmon, sardines, anchovies, and white tuna are all healthy. So those, and you can make them any way you want other than fried.
I love it.
So you want the fish to be baked or broiled or roasted or even sauteed. That is healthy fish because you get the 3-letter DHA, which is good for your child's brain and eyesight development. And in fact, it's good for all of us throughout ages. You want to be a fathead, Angela, because 50% of your brain is fat, and 50% of that is DHA. It's a structural fat that allows one nerve cell to talk to the others, so you get smarter as you get older.
Good stuff. A lot of our parents got it right, giving us the fish oil as kids, saying it's good for us. Yuck, but I get it now. Okay, so fat is good for you. Does that mean any kind of fat that we want, or are there certain fats we should avoid? Break that down for us.
No, so there are 5 food felons, Angela, so you're right, and 2 of those are fats, trans fat and saturated fat. The saturated fat is 4-legged animal fat, 2-legged animal skin, palm and coconut oil. Those, despite what the Time magazine cover says and the book says, that's BS, bad science, because the saturated fat causes your bacteria inside your gut to change. So the bacteria inside you changes, which produces inflammatory mediators, which cause heart disease, stroke, memory loss, wrinkles, even impotence, and increase your risk of cancer. So those, if you will, saturated and trans fat are evil fats, if you will.
That's no good.
And what you want is healthy oil such as walnut oil or almond oil or olive oil or avocados. Those monounsaturated and polyunsaturated fats are healthier.
Very good. Well, it looks like you've got some really good things in front of you for us to eat. We have to let you go, but last word, the latest news on sodium.
Sodium, you want to decrease it, especially if you have salt-sensitive hypertension. You know that when you cut out sodium, your blood pressure will go down 30 or 40 points.
Okay.
For everybody else, we want to gradually decrease it, but don't get crazy about it, and make sure the sodium you have has iodine with it.
I love it. Dr. Roizen, thank you so much. I'm leaving here with great information. Thanks for joining us, and look forward to seeing you again. And we'll be back with more Let's Talk Live right after this.